Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Hello, Dr. Luper. How are you?
Oh, Hallie, I'm doing great.
Good. Well, this month we are looking more deeply into different metabolic markers that you test for. And one of the things you're often looking at is uric acid. So I thought we would kind of go over the importance of that.
Yeah, I kind of have a beef around uric acid because uric acid is something that we should be checking all the time. It's a really good marker of health. It's the single best protector of whether you're going to get diabetes or not, for example. And it mostly is not run as a regular element in a metabolic panel. Now, it is for us. It's part of our regular white spruce medical panel we do, but we're at this point we're a rarity because most people don't have that part of their panel. The thing about uric acid is it's probably one of the more misunderstood metabolic markers. You and I were having a conversation earlier about uric acid, and your comment was, yeah, it's important with gout, right?
Yeah, that's what, when we were discussing topics, thinking of topics, you suggested this, and I plugged in a quick Google search. It came up with gout and the significance of that, and which led me down another bunny trail. But what is the connection between the two?
So the purpose of this particular series of shows we're doing is I want to equip people to be able to interpret common or relatively common lab stuff and make sense of it in terms of their own life and whether it shows that they're healthy or they're pseudo healthy. I'm not sick yet, but I'm on the road to hell, right?
Right.
Like that. So that's what uric acid fits in that category beautifully. And so let me talk about what it is, and then more importantly, let me talk about why it's important. So uric acid is a breakdown product of nucleonic acids and purine.
Purine.
Yeah, and which it would give me just too many fancy words. Proteins have nucleonic acids and purine in them. So when you break down proteins, it gives this residue. This is one of the residues that has to be cleared from the body. This stuff is toxic. Yes. And it needs to be cleared from the body.
So when your body builds up these elements or these molecules, that's when your uric acid is elevated?
Yeah, these are normal things that are part of protein. And so when you break down protein, then the numbers go up. So obviously this is a problem with protein and you eating too much protein, right? That's what I was taught. I was taught that in school, that gout is a problem that you get when uric acid levels are too high. The uric acid crystallizes into these shards that are remarkably similar in shape to pieces of glass. They tend to deposit in our soft tissues in the quiet corners of our body, kind of farthest away from everything else. Yeah, that's our feet.
Extremities? Okay, so in our feet, not so much in the hands?
Not so much the hands.
Okay. Possibly
in the hands. I've never seen it, but in feet. Your big toe especially.
So you've seen my cyst. Do you think that's
not gout?
Okay.
That's not gout. So really what it is, it feels like a piece of glass has somehow got lodged in the joint of your big toe. And so every time you move it, the glass pokes you and is exquisitely painful. Now, we're going to talk about this because we're talking about uric acid, and uric acid, this story is gout. But just a reminder, this is a minor story. This is a relatively rare, it's misery when you have it. It's not minor at all. But for the vast population, really, the uric acid's showing more, it has to do about carbohydrate metabolism than it does protein metabolism. Nonetheless, we're going to start out with protein metabolism. So anyways, the body, you eat stuff that needs to be broken down, and it has this uric acid residue. And so the residue needs to be cleared. The parts of your body that do the clearing are the parts you would expect. Predominantly in this case is your liver, and though your kidneys do about 70% of the clearing.
Yeah.
And liver does about 30% of the clearing.
Okay.
And then, between them, they get the job done more or less. If uric acid levels pile up in the body, it's toxic. Mm-hmm. And that's the reason why our body wants to get rid of it. But it's toxic to all the parts of our body. But the parts of our body that it's particularly toxic to are our liver and our kidneys. Bummer of a job, right? When your job is to get rid of something,
and then
yet
it can't get rid of
you're sensitive to that.
You're supposed to get rid of.
Yeah, right.
Yeah.
Yeah. The math doesn't work out real well on this.
So, do
Yeah.
patients who are like in kidney failure or have kidney problems often do you see high uric?
Yes, I do.
Okay, now patients with liver problems, do you also see
Yep.
high uric?
Yes, I do.
Okay.
Yes, I do. And the thing is, people with liver problems and kidney problems are way more likely to have a problem with carbohydrate metabolism than they are with protein metabolism.
Is that
Diabetes.
the sugar in the blood sugar and
The blood
insulin?
sugar makes all of this worse.
Mm-hmm.
And the uric acid levels make the blood sugars worse.
Oh.
So again, uric acid is the single best predictor of whether you're going to get diabetes or not. Nothing's better.
Nothing. Not even an A1C?
No, uric acid. Uric acid makes the best prediction.
So is there like a certain range that you would be able to tell if somebody was pre-diabetic based on their uric acid levels?
That's an excellent question. The normal range for uric acid, and then this is off the top of my head, somewhere runs around 3.5 to around 7.5, somewhere around there. Though it's weird because normally you want to be in the middle of the range. You got a range. This is low. This is high. You want to be somewhere in the middle. Now with uric acid, you don't.
You want to be
low.
End. Yeah.
Yeah. In fact, the 3.5 is already a little on the high side because my healthiest patients tend to run 2.5.
Okay.
And those ones just everything's working better. They're clearing uric acid from their bodies. Less is better.
Okay.
Less is the way to go. So why does the range go so high? Isn't that weird? I mean,
What's
if it's
the high end again?
7.5,
Yeah.
somewhere around there.
Okay.
8 maybe, depending. Now, if you go by the straight lab rules to figure out what normal ranges are, what you do is you take the population and then you graph it. There's a mean, there's in the middle, and then there's the standard deviation off to either side, and then double deviation off of that, and that's the normal range. 2 standard deviations off the mean is the lab range. It's a forms a bell curve, right?
Right.
Yeah, they're rare, and then they get common, and then they go rare again, and that's a standard lab. Now the problem is we live in the United States where people eat a diet, a supersized diet with Pepsi, right? That just pushes uric acid levels over outside the healthy range into an unhealthy range, and the unhealthy range becomes the normal range.
Well, and I think it'd be so hard for the body to digest everything that it's eating when it's ultra processed, and it's also driving blood sugars through the roof.
Yes, It is. And so the healthy range tends to run around 2 to 3, somewhere around there. Normal ranges run, like I mentioned, 4 or 5 is kind of the average.
So when is somebody in trouble?
Wait. One last thing. There's a pushback from the medical world to lower the high ranges because there's disease associated with the high normals. And so now, for the first time in my career, there's a debate going on that 7.5 is too high, and we should bring it back down to 6.5 as the actual high. Even though these people are common, they fit within 2 standard deviations, and by definition, they should be in the normal range. They're not normal. It's just that normal is in the range of pathology. Okay, that's interesting. It's like reality's catching up with the math, which is lovely.
Well, I think, does that even say that people are oftentimes high on that scale, or
Yes.
that they aren't seeing anybody within those ranges anymore, so that those need to be
No. The
reduced?
normals are the same as they've always been.
Okay.
It's just that people at the high side of normal, I'm sorry, I have to do this. Normal.
Air quotes.
Yeah, those people, they're getting sick.
Yeah.
That's a problem with them. So just because they're normal, because they fit the definition of normal, that is, there's lots of them, they're still getting sick, so they're not normal. So the numbers are skewed, and we need to have the actual healthy normal, or there's another way to say it. And honestly, those go below the whole range.
Sure.
Really, the healthiest people tend to be at the very bottom, beyond the point of normal, where they're abnormally low. Those are the healthiest people.
Okay. So how do you get to that level? How do you reduce it if you have it in the higher range?
Yeah, let's repeat this again. So if the higher your uric acid levels are, the more damage you take, particularly to the parts of your body that get rid of uric acid.
The liver and the kidneys.
Yes. So if your liver and kidneys are taking damage, then your uric acid is going to tend to pile up, which is going to make you take more damage, which is going to make it pile up more. You see where we're going with this thing?
Yeah.
Yeah. This is a bad feedback cycle.
So
It's
a bunch
positive
of uric acid leads to gout, leads to kidney stones, leads to...
Yeah, kidney stones are not a common thing. It's possible you can get uric acid, kidney stones for sure, but it's not a common thing.
What about
Gout also is not a common thing. I've been in practice for 30 plus years, and I've seen, 2 or 3 cases of gout. I mean, they're real. It doesn't exist. It is an exquisitely painful disease. But I've seen so much more diabetes, so much more kidney failure, so much more liver failure, so much more other damage that's much more common that's associated with high uric acid levels. One of the things that helped me, I'd been seeing these patterns all along as a doctor, and I was just perplexed at why we don't concentrate more on diabetes as a cause of uric acid levels being high. But I was a lone voice. No one was saying anything. I wasn't reading anything. And then a colleague, David Perlmutter, I'm just not saying his name right, Perlmutter, wrote a book called Drop Acid. I thought, what a clever title.
Right? It's attention grabbing.
Anyways, he wrote a book that pointed out the connection that had been developing in the research world, which is usually ahead of the practice world, showing the connection between uric acid and diabetes, uric acid and carbohydrate metabolism being much more clinically significant, much more important than the ratio between high protein diets and uric acid. Now, if you eat a lot of protein, you can get your uric acid levels to go up, but it usually doesn't. Usually your body clears it just fine.
Well, I'm just thinking of all the people who are out there doing like carnivore diet.
And being perfectly fine, and their
nothing-
uric acid levels are great. If anything, they're low.
Okay, so when did
Whoa, stop again. We got to say that again. What? How's that even possible? People are eating a diet of only meat,
Right.
and their uric acid levels are low, and they're healthy, and they don't have any diabetes?
Yeah.
That absolutely goes against common sense and what we would think.
Well,
Isn't it interesting how what we learn in medical school doesn't really relate that well to what reality is? Yeah, that's why we're doing the show.
Yeah. But I think in the past 10 years, there has been a lot of noise, a lot of conversation on carnivore diet, a lot of people trying it for all sorts of different diseases that they're dealing with. So it's not, I don't have as big of a jump reaction because my past 10 years within the medical industry, I've heard this conversation. So I don't have the 10 years prior or the 10 years prior.
The scarring
to that.
from medical school.
Right, yeah. So,
Yeah.
But what is it, how did it shift from protein to carbohydrate?
So what happened is people just noticed the patterns. And they just notice that people who eat a lot of meat don't have problems with their uric acid. And people who eat a lot of, carbs do. That's what really drove it. And then people, sitting around trying to think of their next research project, scratching their chins thinking, we should look at this thing.
And I'm interested to know what type of carbohydrate.
The ones that make your blood sugars go up.
Okay.
So refined carbohydrates.
Yeah.
Not complex carbohydrates. Those are less so. It's refined carbohydrates that will do it. Also alcohol. Now, all along, alcohol has been part of the conversation, which was kind of weird because it's meat and alcohol. And gout's really the disease of rich living. The only people that ever get gout are wealthy people, because the only people who can afford to eat like that.
Fat and happy people.
Yeah, fat and happy. So it turns out it was more on the carb side than it was on the protein side. They just happened to get proteins in as well, but the carbs really was driving it, and the alcohol. The alcohol is very closely related to carbohydrates, to diabetes. I mean,
Absolutely.
where sugar goes bad is the same place where alcohol goes bad. There's a lot of overlap in terms of the, liver damage, kidney damage, those kinds of things.
And in your practice for the gout that you saw, was it due to alcohol consumption or primarily diabetes driven?
Diabetes. That's what was driving it. Blood sugars, without a doubt. Diabetes is what drives it. Now, the interesting thing is when I graduated from med school, I learned about a drug called allopurinol that blocks uric acid production. And it works. It works very nicely. But it doesn't necessarily lead to increased health. It'll lower your uric acid levels, but people with allopurinol don't necessarily glow with vibrant health, right? It blocks a metabolic pathway, but it doesn't really solve the underlying problem. And around the same time, I learned of another thing that's used to treat gout, in this case, high uric acid levels, and that's cherry juice. And cherry juice worked better. I mean, I just got better results with it. People were healthier and they felt better, and the allopurinol was like, meh. And then cherry juice is like, woo, I like that. And it always puzzled me, like, why does cherry juice work so much better than allopurinol when it doesn't really block the pathway? It's not there for the same reasons that allopurinol is. And now, upon many decades of reflection, I see exactly why cherry juice is better, because the true problem with uric acid is the environment that it's manufactured in, which is one of toxicity. It's one of high blood sugars and alcohol and fermentation in your gut and the creation of byproducts of that fermentation, otherwise known as toxins. And there's just general inflammatory environment. And so the cherry juice acts as an anti-inflammatory.
Yeah, because of the antioxidant properties in the cherry juice. I would also wonder, because I know cranberry juice is good for flushing kidneys.
Yeah, you'd think it would work just as well. It might. I haven't seen the research on it. Cherry juice got the reputation, but in my practice, in my experience, no juice works better to regulate blood sugars than cherry juice. Cherry juice has a special affinity for bringing blood sugars down. So cherry juice is used routinely in my practice to treat diabetes, not by itself. It's not like cherry juice is a cure for diabetes, but it's a piece in the overall plan to bring your blood sugars down. I'm using too many words. What I'm trying to do is trying to get those peak blood sugars to come down. And just generally bring the blood sugars from above the normal range into the normal range. So how do we do that? Well, you're going to change people's diet and have them exercise, have them sleep well at night. That's super effective. Oddly enough, what does sleep have to do with blood sugar? They're connected.
Oh, absolutely. And when you wake, and in the pattern that you wake, and in the pattern that your body releases the cortisol, all of that matters so much.
We've talked about this before.
Right.
Sleep is profound. So is anthocyanins.
Yes.
Those are the purple pigments that are in fruits and vegetables. Those work very well at regulating blood sugars, not just because they're like another form of metformin. It doesn't work that way at all. What they do is they act as anti-inflammatories. And with the inflammation coming down, that the body's production of cortisol comes down. And the body's need for insulin comes down. And the body's regulation of blood sugar just improves overall, because it acts in a way to help us become more healthy. Literally, our bits and pieces become more healthy in general under the influence of cherry juice. We somebody come out as a healthier version of ourselves. That's why the uric acid levels come down.
So
because we're coming out healthy.
What else do you use? Cherry juice is good to lower uric acid. Are there any herbs?
So with the strategy that I just laid out, I could bounce that question back to you.
And I could answer it, but I'm not the doctor on the show.
Okay, so what we see here is that inflammation is what's driving the uric acid production.
Yeah.
And the reason for that is because uric acid is toxic and needs to be cleared out of our system. And the parts of our body that do the clearing are the parts of our body that are particularly sensitive to the effects of the toxins. So if you get more toxins, then our bits, that's our liver and our kidneys, don't work as well, so the uric acid levels back up.
Yep.
So now the question is, how do we get our liver and our kidneys working better? The answer to that question is the answer of how to get uric acid levels to go down.
Okay. So cherry juice.
Yeah, cherry juice turns out to be helpful for both of those things.
Mm-hmm.
And then about 50,000 other things.
And then some anti-inflammatory. We use tincture.
Yeah,
So-
let's pick one that works really well. Our best tincture for anti-inflammatory is a combination of curcumin, which is famous. The turmeric is a famous anti-inflammatory. Licorice root, glycyrrhiza, likewise super famous, been used for thousands of years, right? And then mushrooms.
Ganoderma, or
in this case, reishi mushroom.
Yeah.
Now we don't have to use Ganoderma. We could use other mushrooms. The chaga that grows on the birch trees here in Fairbanks, that would work fine.
What about ashwagandha?
Which is a lovely anti-inflammatory herb. That would be helpful as well. I wouldn't put it in the top three. We'd basically get curcumin, licorice root, and some mushroom.
Okay.
That's what what works best. So the other mushroom that I really, really like is cordyceps. Cordyceps.
You've been using a lot of cordyceps.
Because I like it. I like the effect of cordyceps. Cordyceps is very helpful.
we haven't been using it in tincture. We've been using it in powder.
We could get it in tincture form. I can get more in a stronger concoction in the powder form. So if we want to really do a lot of anti-inflammatory, we'll do the 3 ingredients in our regular formula and then add the cordyceps on top of that. Mm-hmm. So what are the situations that we use that kind of strong anti-inflammatory? Kidney failure, liver failure, cancer, because inflammation's super high with cancer most of the time. It's at least advanced cancer. Things like that. Diabetes is another one. And then the other part of the body that suffers from uric acid or elevated uric acid is your nerves. Mm-hmm. And so all of these same treatments for liver and kidney would also be helpful for nerves. So it's the same kind of situation. The herbs that we've mentioned, the cherry juice we've mentioned, and cherry juice doesn't have a monopoly on helping people with uric acid levels by any means. There's lots and lots and lots of juices that are purple, and all of them more or less are going to be helpful, more or less. One of the more famous ones is pomegranate. Think about pomegranate. It's very famous for being an anti-inflammatory and helpful and healthy, but the purple concentration's kind of low in it. Now it's good. If you do enough pomegranate juice, it's great, except for you have to drink more.
And it's higher in sugar.
Yes, and that was the next point I was going to make. And so is grape juice.
And then we don't recommend grape juice.
Because it's too high in sugar. Whereas cherry juice has a fair amount of sugar in it too, but less, and it doesn't raise blood sugars up as much. Now, if you drink a glass of cherry juice, and normally the dose I recommend is 4 ounces a day, but I don't recommend drinking it as juice. I recommend diluting it 3/4 with water. So you take a 4-ounce glass and you turn it into a 16-ounce pint, and then drinking that instead. And then to make it even better, let's throw some chia seeds in that thing.
Yeah.
And do a couple tablespoons of chia seeds, and now you get this blood sugar lowering, anti-inflammatory, soothing to your gut concoction.
Yeah, super fueling to the digestive system.
Yeah, let me lean on this one again. So the thing about the chia seeds is they soak up the water, some of it, most of it, and they have this gel coating on the outside, and that gel is soluble fiber. And it turns out to be a fabulous thing to feed beneficial bacteria. So if we can feed the beneficial bacteria, then we can improve the quality of fermentation in general, of stuff.
And then does it also extract all the toxins from the bad bugs?
Some.
Okay.
But a lot. Mm-hmm. I wouldn't say all, but a lot. Again, too many words. What we're doing is people who are sick, have bad guts, that are toxic, and they have bad organisms, and it's all a big mess down there. That's the standard American that's got their uric acid levels running 5, 6.
Yeah.
Really.
Yeah.
Common. So how do we turn those people into these other type of people that got their uric acid levels in the 2, 3? Well, we got to get them healthy. And how do we do that? One of the main ways we do that routinely every day of the week here, we heal people's guts. And one of the most powerful tools we have to heal people's guts is this mixture of purple juice, mostly cherry, and water and chia seeds. And you let it soak for a few hours or overnight, and then you drink all of that. That's 4 ounces of cherry juice, 12 ounces of water, 2 tablespoons of chia seeds, yeah. And then you drink that the next day, and just do that every day. Have that be a regular thing, and it will change your life.
Yep.
People lose weight. People have better organ function. Their skin clears up. They have more energy. I mean, the list goes on and on. Now, it's not a thing that'll cure every disease known to man, but nearly. I mean, it's one of those things that really move things forward. So let's go back to the beginning of this. Uric acid is a good marker for health, and it's much more than the story of gout by itself. It's better to think of it as really a marker of kind of oxidative damage, of blood sugar dysregulation, of really wreck and ruin, the kind of stuff that wears us out, ages us, that weakens us, and then leaves us as wrecks at the end of our life. So if we could get the uric acid levels to come down, not because the uric acid is the thing, it's just a marker.
It's the hint. It's the
hint. It's the clue that things are all coming undone.
Yeah.
It's a super useful clue that you really get a broad perspective, and even from that one number. It's by its nature, it's a broad perspective that lets you go kind of about how healthy you are. So let's go through the numbers again. The regular range runs from 3.5-ish to 7.5-ish. And so if you're running on the low side, you're good. You're running in the middle, you're not good. What? I'm in the middle. No, you're not good. You're too high.
You don't want to be in the middle.
You're too high. You don't want to do that. You want to bring it down. You want to think of ways that you can change your life to improve your organ health.
Sleep, eat better.
Yeah, right. Exactly. Those things. You want to think about particularly doing the chia seed concoction we talked about, because it's got the cherry juice in it already. And it's got this other anti-inflammatory stuff. If you want to pull the stops out, there's this anti-inflammatory tincture that you could do, we mentioned before. And then also you want to kind of big picture again, look at what you're eating as whether it's something that's going to promote inflammation or something that's going to decrease inflammation.
And whether it's easily digestible or not.
Which is the key.
Yeah.
Which is the key. That is the key. Is it going to be pro-inflammatory? The answer is if it's undigestible or poorly digestible, yes.
Yeah.
If it's going to be anti-inflammatory, one of the better ways to tell is if it's easily digested. Because if we can digest it, we can break it down, we get it.
Yeah,
we get to keep it.
Yeah, the nutrients gets absorbed. It's not sitting undigested, causing inflammation.
So I had a patient recently I was talking to about this, and I said, one of the ways that we can help you is by having you eat less. And my patient went, no, I need food. I'm hungry. And I was like, okay, so if you eat more, who's going to benefit? You or your nasty, horrible bacteria? Because they're living on your leftovers. You feed them more, not only you have to deal with your own poop, you have to deal with all their poop.
But in changing that mindset, having that mindset shift to, okay, eating more, but eating more of the anti-inflammatory foods, like more spinach, or more broccoli, or more something in place of the starch that they're having, the carbohydrate that they're having.
That's a great way to do it. You know, the best way to do this thing is to do it in baby steps.
Yeah. Because
baby steps are doable, because they're small. And you make these little changes. You try to do big, giant changes and blow your life up.
Yeah,
the chances you're going to blow your life up.
Time.
Yeah.
Wonderful.
Okay.
Thank you, Dr. Luper.
My pleasure.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.